Hello, my name is Jen Frost. I am the Health Services Director for Gilbert Public Schools. I would like to update you on some modifications to our health office protocols on campus and at a district level, so we can be completely transparent and support you and your family during this time. This year, because of the pandemic, health office protocols and procedures will look different than in years past. I'm going to outline for you what will happen if your child goes home ill, tests positive for COVID-19, or is exposed to COVID-19. Minor health issues will be dealt with in the classroom. Our plan is to keep healthy children out of the health office as much as possible. Students that need medication or nursing services will be seen immediately and go straight to the treatment room and then return to class. We will be seeing more students sent home for minor symptoms that can be indicative of COVID-19. Per Department of Health guidelines, it is important for us to err on the side of caution. As a rule of thumb, if you think your child needs medication, such as Tylenol or cold medicine to get through the day, we recommend that you keep your child home from school. As a reminder, parents, please continue to conduct the student daily health assessment prior to sending your child to school. Per Department of Health guidelines, and depending on the situation, if your student is sent home, he or she may be required to stay home for up to 10 days. Depending on the circumstances, your child can come back to school if you have verification of a negative COVID-19 test or a doctor's note that states your child has an infection other than COVID-19 and is taking an antibiotic medication to return to school. For details of where you can get a COVID-19 test, please visit our website for a list of locations and resources. If your child is exposed to COVID-19, which means that they have been in close contact with someone who has been diagnosed with COVID-19, they will be required to be out of school for 14 days. Please notify our health office to discuss a safe return to school and ask for testing resources if needed. Symptoms typically appear 2 to 14 days after exposure. If your child develops any of the following symptoms, please see your healthcare provider or consider getting tested. Fever, a new cough or shortness of breath, headache, body aches, loss of sense of taste or smell, chills, sore throat, diarrhea, or vomiting. If your child tests positive for COVID-19, please contact your school and state there was a positive test. Your campus health office will then contact you to determine a safe return to school date. Your child will need to check in with the health office before being allowed back to class. And as a parent, you can also call your health office to discuss how best to prepare for a return to school. Please know that if your child is sick at school, your health office will be calling you and asking you to come pick up your child within 30 minutes. It is for the health and well-being of your student and in the best interest for our entire community that your student is not in the health office for an extended period of time. It's important to update your child's medical history on Infinite Campus. If your child has seasonal allergies or a recurring health issue, such as headaches or migraines, it is important to make sure that information is noted on their annual update. We want this year to be as healthy as possible for all of our students, families, and staff. Please adhere to the procedures so we can maintain a healthy environment for all students. Thank you, and please feel free to contact your campus health staff anytime you have questions, or you can visit our website for more information and resources.